everybody. My name is Eric Keys. I'm practice manager at Refined MD in Los Gatos, California.
And I'm Jazmyn Marino. I'm a registered nurse here doing body treatments as well as aesthetic treatments here at Refined MD.
We're going to be talking about a non-surgical lifting procedure that we do in the office. This is called Ultherapy. It has had a lot of press recently, and it's a very exciting procedure.
Stay tuned for more information.
We're here discussing Ultherapy and just a little bit about kind of how this technology works. It's designed to tighten, and it has an FDA clearance for actually doing a non-surgical lift to your face. A lot of people approach this treatment as a non-surgical facelift. It can be done easily, just in a single day. There are no, patients don't experience any downtime. We easily manage comfort here in our office, so you're not out or anything like that. This is a non-invasive tightening treatment. The technology is called HIFU, high intensity focused ultrasound. This ultrasound energy, when the beams of ultrasound collide deep in your skin, they create a hot point or a thermal coagulation zone. And it's that destruction and then remodeling of collagen that causes the lifting. And I think Jazmyn is going to show us the equipment and how it works.
Yeah. So this is the screen that we're actually looking at. We would put your patient information in here. This is the handle piece, which the ultrasound energy, which allows us to see and treat. And then this is the screen here. So this is the kind of facial mapping that we do. And then this little depth portion right here allows us to actually see the area that we're treating and the depth that we're treating at.
So can you actually see beneath the skin with this?
Yes. Yeah, we're using ultrasound technology just like you would when you go, when you're pregnant and you go to an ultrasound. You would see the different layers of the skin and the collagen that would be inside underneath the skin.
And I don't know if people there watching the video can see, but there are zones on the face that have little numbers in them. Can you explain what these numbers mean? Oh, oops, touch the screen.
So these numbers are actually the number of lines of treatment that we do. So they're very small, minute movements that we do along the face in order to target each section on the face to lift and cause collagen to denature, which your body then builds it over again.
Got it.
And then here for your neck, same thing, but we can tailor each treatment to
That's
the
part
individual.
of the beauty. I read part of the beauty of Ultherapy, that you can customize it. So, can you do other parts besides just the face, or?
You can do the neck. You can also do like the décolletage or the chest as well. But I believe those are all the treatments, just kind of like chest up.
So, if I were coming in for treatment, what should I expect?
Yeah, so when you come in for the treatment, we usually take like before and after pictures. When you do come in, we ask that you come in about an hour to 45 minutes to an hour to numb, just to make the treatment a little bit more comfortable. While you're numbing, then I would probably get the machine ready and everything. We would section out the face, kind of like how you see it here with the lines. So we just use like a little pencil to quadrant the face for the treatment areas and treatment zones. After that, then we would actually start the treatment. So we would apply like an ultrasound gel over the face, and then would use the handle piece, and you would be able to see the layers of the collagen in the skin. We first look to see what we're targeting, so we can actually see the layers of collagen and how deep the collagen is, so we can kind of tailor the treatment accordingly. So we would, depending on the area of the face, we would switch to transducer depth for what is most beneficial for the patient.
So I'm kind of keen on trying this. How about you do a little demo on me today?
Sure.
Okay, I'm going to go get surgery top on. Stand by.
I'm just going to put a little ultrasound gel, which kind of helps the transducer glide on the skin a little bit easier and allows us to see the area we're treating. It's a little cold, but
all marked out.
So then if you look on the screen, we're gonna see what we're seeing, what we're treating here. And that's a layer of collagen on. You want to make sure you get good visualization while you're treating. If you don't, then you'd just reposition.
So I've had nothing as far as any
Oh yeah, and then numbing.
aspirin or numbing.
So Jazmyn, in your experience, what does this treatment feel like? What are patients' feedback? What is patients' feedback?
I feel like it's all over the place in regards to some patients take it really well, and then some patients, depending on their tolerance level, it might be a little more uncomfortable for them.
So do you give any special oven to get them through this treatment?
I do. I try and distract them with like talking to them. If they need to take a break, we take a couple breaks, take a deep breaths together. But I've never had a patient not finish the treatment, and after they were done, they say, "Oh, that was a little spicy." And I'm like, "Yeah." I was like, "But you'll love the results." And
what do they tell you about how it feels on the skin, though?
Most
Is it
patients, it's not hot. I feel like they can actually feel the micro injuries underneath the skin. They haven't really described on how it feels, but I know that it's tolerable for each patient.
Yeah.
It's different for each patient as well. Some patients don't feel much, and then other patients are like, "Wow, that kind of hurts."
When I observe some of these treatments being done, I feel like they tell me it's almost like little, some woman described it as 4th of July sparklers underneath the surface of her skin.
Yeah.
And she kind of said it's a little bit electrical and a little bit kind of hot. And, she said that it starts out pretty comfortable, this is what she said, but after a while you kind of like wear out. And so she just said, that she liked to listen to loud, crazy music during the treatments.
I think towards the end, patients do feel a little bit more because by then, their topical numbing is weared off. And because of the way we do the treatment, we're starting off deep, and then we move to the surface, which I think more sensation on the surface with the transducer. So they do feel it a lot more, especially like in the neck or on the chest or like near the jawline where there are arteries and nerve bundles that are more sensitive. But that's expected.
Yeah. So when a patient comes in, Jazmyn, how do you know that they're a good candidate? Why should they choose Ultherapy?
I think anybody can really be a candidate for Ultherapy. When you do come in to the office, we do a consultation and we can see what other options you might have. But for Ultherapy, I think it is a subtle treatment and people see subtle results over time. So I feel like anybody is really a candidate for Ultherapy if their main concern is that they want to lift the skin, prevent wrinkles, and stimulate collagen. If those are your main priorities, then Ultherapy would definitely be something that would benefit.
So is it different from laser? Because everybody comes in and laser. So what do you tell patients? Is this laser?
Well, so this is not a laser. It's more of a underneath the skin treatment. Usually lasers treat on top of the skin, but with Ultherapy, you're making the micro injuries underneath the skin, and so that's what causes it to lift from the inside versus just on top.
Oh, so that's the important
That's the
distinction.
difference
It's
between
the lifting.
Yes.
Other group of people that are really strong candidates, I think, are Hispanic and Asian patients. We see really good results because these people have strong ability to build collagen in general. kind of almost much better than in my experience, in my observation, Caucasian skin. Caucasian skin, middle Asian, it starts going south, but people of Asian and Hispanic descent do really well with this treatment.
So Eric, who would be a good candidate for Ultherapy?
My God. Okay, I see people of all walks of life, all ages come in. Both men and women. There's a segment of the population that's really concerned about maintaining their appearance and maintaining like skin tautness. So these people of like age 30 to 50 who are still in strong collagen building years, they're awesome candidates, I feel. And they get like exquisite results that they can really see. People like when they're pushing that age where they really should be considering like a surgical lift, they're harder to like make happy with this treatment. And I think they come out already saying like, well, the results were like not as good for me. And I think those patients, and those patients who resist surgery but are truly surgical candidates, if they do 2 of these treatments, I think they get themselves to a point where they're happy then. But they need that kind of stack treatments. Maybe treat and treat again in 4 to 6 months, and then I think you're happy.
Okay, so can this replace a facelift?
Well, great question, because we get a lot in the practice, but Ultherapy does not match surgical results. But that being said, this is a great prejuvenation tool, something for people that aren't ready to take that leap and do surgery or like do something with general anesthesia involved. This is really something, an in-office procedure. This used to be called the lunchtime lift, something that can be that easily, like in an hour and a half. The other nice thing about Ultherapy is for people who have had facelifts, this is a nice way to maintain your results. So how should a patient take care of themselves after an Ultherapy treatment? What should they expect, like the day of, the day after?
So usually patients can experience some redness, some swelling, maybe some tingling. Using cold packs, so just for the swelling, they can use like an ice pack after their treatment.
Now, would you expect bruising from the treatment?
Some patients do bruise. It just depends on the patient. Every patient reacts differently to the treatment. We've had some patients experience some swelling and bruising, but it lasted maybe like for a few days, like 2 or 3 days.
Okay, thanks.
So Eric, what do you tell patients when they come in for their consults and they ask if it's painful or uncomfortable?
Great question. Of course, everybody has a different threshold of pain, so I kind of like to acknowledge that this is a little uncomfortable. However, we have many mechanisms of kind of moderating the discomfort. For instance, we can administer laughing gas. We can use topical numbing for various parts of the face. We often suggest that the patient takes some ibuprofen an hour prior to the treatment. So all in all, I've never seen a patient that has had to discontinue, for instance, the treatment in the middle of it. We get you through it. The treatment lasts about an hour and a half. And at the end, there's kind of you're done with the discomfort. Jazmyn, what do you tell patients? Like, you probably get the question, how long do these results last? And when will I see my results?
Yes, the results last for up to a year, and then patients start to see results as soon as 3 months, but they can actually continue to see results after 6 months.
Okay. So I'm going to finish up my treatment here with Nurse Jazmyn, and if you want to look as good as me, book a consultation for an Ultherapy treatment here. It's easy.